Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Ranitidine. Its brand name is Zantac. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how ranitidine works. We'll then discuss indications or reasons we prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe ranitidine. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects. So how does ranitidine work? Well, ranitidine is a competitive H2 receptor antagonist. It reversibly inhibits action of histamine at the histamine H2 receptor. In terms of indications or reasons we prescribe this medication to a patient, we may see it used in the treatment of indigestion or gastroesophageal reflux disease, also known as GERD. It may be used in the treatment of a duodenal ulcer or erosive esophagitis. Patients with gastric hypersecretion may use this medication, as well as patients with a gastric ulcer. And finally, it can be used in the treatment of Zollinger-Ellison syndrome. With respect to contraindications or reasons we would not be able to prescribe ranitidine or give ranitidine over the counter, this medication would not be given to patients who have a hypersensitivity to ranitidine or any other component of the formulation. Now, what about dosing with ranitidine? So, in the treatment of gastroesophageal reflux disease, or GERD, we may see 150 milligrams given orally twice daily. If a patient was treating indigestion, they may use 75 or 150 milligrams orally once or twice daily. The maximum dose in this situation would be 300 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using ranitidine or Zantac, so I'll go over some of those here now. You'll notice by these side effects that they're very mild. This medication is very well tolerated. Some patients may experience constipation or diarrhea, as well as abdominal pain or a headache. Now, some more rare but serious side effects would be abnormal liver function tests or a bradyarrhythmia. That's all we're going to talk about today with ranitidine or Zantac. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.